Hello, welcome to my YouTube channel. My name is Tita Aki, and today we are going to talk about acute pulmonary edema. Acute pulmonary edema is a condition where fluid accumulates rapidly in the alveoli and interstitial lung spaces, thus making lungs to stiffen and impairs expansion, resulting to severe hypoxia. This condition requires emergency attention. If you work in hospital, it's time to activate a rapid response or your emergency system. If you're at home, it's time to call 911. Causes of acute pulmonary edema: CHF, viruses, bacteria, allergies, infusion, drug hypersensitivity, poison, narcotic overdose, head trauma, cardiovascular, smoke, transfusion such as blood transfusion, MI, post-anesthesia, CVA, pulmonary embolism, parasitic pneumonia, coronary artery bypass grafting. Signs and symptoms of acute pulmonary edema: you will see dyspnea, you will hear crackles, wheezing, tachycardia, anxiety, restlessness, tachypnea, that's breathing fast, profuse sweating, cyanotic cold clammy skin, tracheal venous distension, blood tinged fronty sputum, nasal flaring, use of accessory breathing muscle. Now let's discuss about laboratory and diagnostic studies. They will do chest x-ray which will show vascular congestion in lung field. They can also do multi-lumen pulmonary artery catheter which will show elevated central venous pulmonary artery and capillary wedge pressure. They can do also APGs which will show decrease in PaO2 and increase in PaCO2. You will see also decrease in pulse oxygen saturation less than 95%. Now let's talk about medication that is used during acute pulmonary edema. Morphine, diuretics such as furosemide or Lasix, cardiac glycoside such as digoxin, AC inhibitors such as captopril or lisinopril, low dose of beta blockers such as carfentanil or lopressors, vasodilators, nitroglycerin, and dopamine. Now let's talk about nursing interventions for acute pulmonary edema. Place patient in higher Fowler position, which is the head of bed should be 90 degrees. Administer oxygen, start IV, administer medication such as others such as diuretics and morphine, insert Foley catheter, prepare for intubation and ventilation support, monitor vital signs, provide continuous assessment, assess renal status. Now let's talk about patient teachings. Weigh yourself daily, measure intake and output. Eat food high in potassium except when you're taking medication that conserves potassium such as potassium sparing, low sodium, low fat and low cholesterol diet. Balance periods of rest and activity. Avoid over-the-counter medication. Report edema and weight gain to the provider. Limit caffeine, tea, cocoa, chocolate, and carbonated beverages. Comply with fluid restriction. Avoid isometric activities. Take medication as instructed. Report medication side effect to the provider. Do not stop taking medication because it's going to precipitate acute pulmonary edema. Complications: liver congestion, arrhythmias, thromboembolism, kidney failure, heart failure, respiratory failure. Thank you for watching my YouTube channel. If you like my video, subscribe and share with your friends.